Hi, I'm Jen Barnes, and you're about to experience how to ditch the old ways of doing things, embrace your neurodivergence, learn tips and tricks to function optimally, and love yourself, neurodivergence and all. Welcome to the Self-Loved Woman podcast. Hey, it's Jen. I'm so glad you're here. We've got another super special episode. I'm so excited to bring Dr. Justice onto the podcast today. She's going to talk to us about the intersect between ADHD, trauma, and hormones. And I'm thinking, whoa, she is right up our alley. So I can't wait to dig in with her. So here's Justice. Do you want to introduce yourself a little bit?
Sure. Hi, Jen. Thank you so much for having me.
Yeah.
I am a doctor of acupuncture and Chinese medicine. I also have a background in naturopathy. So I'm trained in Western and Eastern medicine. And my specialty is trauma-informed care.
Whoa, what's naturopathy?
So it's basically the Western answer to Eastern medicine.
Wait a minute. So like a naturopath kind of thing?
Yeah.
Oh, okay. Got it. Okay.
I practiced as a naturopath in a couple different states for 12, 13 years before I completed my doctorate in Chinese medicine. I also have a master's in Chinese medicine.
That's amazing. Oh my gosh. This is going to be so cool. It's going to be so cool. So we're going to talk about this intersect between trauma, ADHD, and hormones. And I just wonder, what do you notice about that, about how that all comes together? Yeah.
Yeah. So it's really interesting, right? So I started my career in fertility.
Oh, okay.
Women's health and fertility was my specialty for the first 8 to 10 years of my career. And over time, I just started noticing this underlying trend of there's always some underlying trauma of some sort that's interacting with how the brain communicates with the rest of the body. Yeah. So I actually switched my specialty at that point and started digging in. And of course, I think so many of us come to this field because of our own trauma, right? We want to figure out first.
Yes.
So, it helped me work through a lot of stuff too. But then I just realized so much of disease and dysfunction and dysregulation is just trauma. It's just a response from the brain that's telling the body that it's not safe.
Yeah. That makes sense. That makes a lot of sense. I always tell people when I explain this, I'm also a psychotherapist, and well, you're not a psychotherapist. I'm also into trauma-informed care, actually help people heal trauma. And one of the things I tell people when I talk about the link between trauma and the body is I'm not trained in autoimmune conditions, but I can list off 5 and I know the symptoms. And it's not because I diagnose them or anything. It's just that so many of my clients come with them.
Yeah.
Yeah.
Well, the body keeps the score, right?
Right.
Yeah. I tell my clients all the time, I'm like, please read the book.
Yeah.
It's so true. And it's such a new concept to us, right? It's not new to health. And especially medicine is great because that was one of the things that kind of tipped me over, was realizing there's these, what we call patterns in Chinese medicine, and in Western, we'd call them diseases. But we
like that.
I know.
I like that.
I like it more because we don't need that labeling. We don't need it to get stuck in our head that we have a disease, right? There's something wrong with us. In my mind, there's nothing wrong with your body. It's working optimally, as a matter of fact. It's very efficient at protecting you. Your body's first and only priority is to keep you alive. It does not care if you feel pretty. It doesn't care if you have energy. It doesn't care. Your heart is beating, your lungs are breathing, and that's about it, right? So it communicates with the body in different ways, but that energy has to go somewhere. So I can't deal with this right now. And as you know, the brain will compartmentalize and it'll block off memories that it doesn't want you to have to worry about right now. Like, no, that's too traumatic. We're not going to listen to that. But the body still has that energetic frequency of that trauma. So it has to store it somewhere. And that tape that whatever happened is playing in your brain is still running through your body. So you're still in fight or flight mode. And all of those excess hormones that are causing, or that have been caused to be produced because of this fight or flight response, now has to go somewhere. So you've got all this frenetic energy that's just like bubbling up inside of you because there's so much adrenaline, there's so much testosterone, there's so much DHT. There's like all of these hormones that the body is just trying to get you through this danger situation, right?
Right. The threat. Yeah.
So until you turn that off, we can't regulate your hormones because your brain is going to be like, you're cute. I'm going to override you. Like,
Whoa.
yeah.
Well, whoa. I'm having a huge aha right now because a lot of the people I know in my life have teenagers and they're going through perimenopause. And I know we might get to perimenopause later, but I'm thinking about like the stress of having a teenager and like there's a fair amount of fighting I hear about.
I'm certain. Yeah.
And
Yeah.
so I got to believe even that probably impacts the
It's a buzzword, the HPA axis. Have you heard of this?
Yeah, I have.
So that it stands for hypothalamic pituitary adrenal.
Yep.
It is important, that whole feedback loop.
Right.
Really what we should be looking at, especially in women, is HPG, hypothalamic pituitary gonadal. So it in the pituitary that sends signals to the reproductive organs. So women, especially if we don't feel safe, we are not going to regulate our hormones properly because you need to feel safe to reproduce.
Right, right. I talk about all that the time. If you're not regulated, you're not going to be able to get pregnant.
Exactly. That's why I was like, okay, my fertility stuff is like all wrong.
Right.
It all hurts differently. But that translates into perimenopause as well, and menopause. Just because you aren't necessarily having a child doesn't mean that feedback loop isn't still going, right? It's a negative feedback loop, meaning if your brain thinks that you don't have enough, it's going to trigger more. So until you feel safe, it's not going to happen.
Right. Right, which is so much what I talk about, but from a different lens. I tend to use polyvagal theory, which for those who are listening, you've probably heard me talk about this, where we talk about like the ventral vagal response. And I sometimes talk about that like the puppy dog, where we're able to rest and digest and connect. And that's kind of where we're supposed to hang out most of the time. And then we're supposed to blip into our protective responses of the fight or flight response, which is the sympathetic nervous system, or we go into shutdown if we see no hope of getting away, which is the dorsal vagal response. So you all have heard me talk about this before, but just for a review, because we're starting to talk about some of that, but that's exactly what Dr. Justice is saying. Is if you're not, and that's what I always say. I'm like, well, if you're not ventral, you're going to have a very hard time getting pregnant, because if a tiger is chasing you, it doesn't matter if you can digest the food in your belly, fight off the flu bug, or have a baby, because like all your energy needs to go to getting away from the tiger, or you'll die, and then you can't do any of those things anyway. So exactly. So
and I often use bears.
Oh, you use bears, yeah.
I think bears.
I think I use tiger because of Peter Levine talks about the invisible tiger. So I think that's where I got tiger.
Totally.
But
I liken it to kind of the same thing. Like if you are hiking and you run across two grizzly bears fighting over food, you're not just going to try to break them up, right?
No.
You're not going to be like, oh, guys, let's not fight. You're going to be like, I'm going to go the other way. And that's kind of what happens with the brain. And when I'm trying to help people regulate, we can't come in and give them herbs to regulate. You have to kind of come in with kid gloves and be like, it's okay. Everything's going to be all right. But it is exactly what you're saying. It's the brain actually, not only is it that it doesn't matter if you can have a baby or digest your food, you physically can't. Your brain shuts down all of those systems.
Yeah.
Redirects everything to your respiration, your heart, and your limbs so that you can. That's essentially what it is. So if you're constantly in that state, it's going to look like ADHD.
Oh, wow. Okay. Now, wow. Interesting. Okay. So hold on now. This is fascinating. We're getting into some interesting territory here, because there is a lot of evidence to suggest that that a lot of people who have trauma get misdiagnosed with ADHD.
PTSD and PTSD, they overlap with ADHD symptoms, and actually the symptoms of being on the spectrum as well.
Well, that's actually what I was going to say, though. This is where I was going to say, because I want to get into this, because this is going to be controversial for my folks and
Sure.
and a little bit for me. So I'm glad we're talking about this. Okay. So that's actually what I was going to say. There's a huge overlap between autism and ADHD. And so I'm like, okay, how do you explain autism then? But you're saying even that could be your body's response to trauma.
Well, yeah, let me be clear. I'm not saying all cases of autism or ADHD.
Okay. Okay, got it.
I'm not saying that. I'm saying that, yes, there is a huge overlap, that perhaps you're missing a huge population of people that we're just throwing pills at.
Yes.
Really need trauma care.
Right. Right. Well, that's why Bessel wanted to get the developmental trauma disorder in DSM-5, but then the pharmaceutical companies lobbied against it. Because if people aren't misdiagnosed, they don't make money.
Exactly. Yeah. Well, that's a whole
other controversial topic that we're not going to touch on any more than that. But,
I can get a soapbox on that one. But I don't think anything is simple and cut and dry, right? Especially when we're talking about the human psyche. There is
for
so
sure
much we don't know, and that we ethically can't figure out right now, right? Like, it's just not ethical to study on live humans the way that we would in order to understand the psyche.
Right.
So I'm not saying that every case is this or every, I would never say that to a patient either. Like, oh gosh, it's just a trauma thing. Like, no. These are really, really big deals. And I am of the opinion that we really, really need to reframe how we look at emotional and physical traumas, because when we see trauma, people think bloody.
Absolutely, they do.
They think I got in an accident. Like, yes, those are traumas. However, so is living through a global pandemic.
Yeah.
So is living with an emotional abusive partner. So is, it could be something as small as somebody made fun of you. Well, that's not small, right? But
right. It's not rape.
It's not, right? But it's somebody just said something to you that triggered something in your brain, and that was traumatic to you. And we really, really need to understand that an emotional or mental trauma is just as dangerous, or needs to be treated as carefully as a broken bone or something physical.
Absolutely. And I love that you're saying that. One of the things I always say is trauma is trauma. Your brain doesn't know the difference between someone, sexually assaulting you and someone giving you a dirty look. Like, it just doesn't. And so you're right. It all is trauma. And that's a really important discussion to have is emotional, mental trauma, psychological trauma, all very, very important. There's actually been, it's been a while now since I read it. There was a study that came out indicating that actually people who had the psychological and emotional trauma had even harder outcomes than people who although it's hard to believe someone would only have physical abuse or only have sexual abuse, because usually it goes hand in hand. But it was definitely the emotional piece. And I can attest to that. When I used to use EMDR on that a lot. Now I use IFS, internal family systems, for those of you who are listening. But when I would do EMDR with folks, the trauma that would clear really quickly were the things like the sexual abuse, the physical abuse, and then the trauma that would just, oh my gosh, it would go on and on. It would take so long was the emotional, the psychological, just all that. And so, it's not to say that's worse either. It's just your brain experiences trauma. It experiences a threat. It doesn't go, oh, is this threat a small threat or a big threat? Like,
it does not prioritize. It doesn't, it just threat, and that's it. It would, terrible to say, but like running into a crowded space and yelling bomb, right? Like, that's kind of what your brain does. I joke, that's not such a joke, but your brain's kind of a drama queen. Kind of though, especially when you have a history of trauma.
Yeah, to keep you alive.
Especially those of us that have hypervigilance, or, that are just constantly like, what's going on? What's behind me? I know I need to have my back to a wall. That's constantly keeping the adrenaline going through your veins, right?
Right.
So, and those are excitatory hormones. There's steroid hormones. There's reasons why people who bodybuild inject steroid hormones, right?
Right.
It gets you going. It's what gets you up in the morning. It builds muscle. It does all those things. It makes you more of a predator and less a prey, if that makes sense.
Right. That makes sense. I was a former bodybuilder, but I never did like any kind of stuff like that. I just lifted heavy weights for my size. Anyway, but I remember some of those guys and it was like, whoa, definitely predator energy there. You know, I dated one, definitely a predator. I was like, ooh,
Yeah.
learned the hard way on that.
I think we all have at least one of those, right? Mine
Yeah,
was
I was young and
so
a little stupid. So
again, I think we've all been there.
yeah.
That's the stuff that I think we really have to look at.
Yeah.
Really want to get long-term healing. So, I'm different in that I tell my patients first, like, I'm not a take this pill, call me in the morning type of doctor.
Yeah.
I need a 6-month commitment from you minimum to
I love that.
like scratch the surface, because you didn't get here overnight. And clearly everything that's you've been trying up to this point hasn't been working. But in order to turn off that tape, we have to do this multimodal kind of approach, right? We need to, I refer out to therapy all the time. And honestly, find a therapy as long as it works for you.
Yeah.
You can, just a therapist you resonate with and
Right.
let's find some sort of physical medicine. So, either acupuncture or if you want to do yoga, I don't care, but you need to move the tissues and move the fascia so that the trauma can get released.
Right.
That's one of the things I love about acupuncture so much, is because the immediacy of it, right?
Yeah.
But it's not a one size fits all. No medicine is one size fits all. We really all should be working together for the best.
That'd be nice. It would be so nice. Yeah.
That's my dream.
It was so nice. One thing I will tell you that was really beautiful when I was in Colorado, they allowed therapists to get trained in ear acupuncture. So I was trained in AcuDetox, so that we could have more connection to other things. And there was a clear effort for the communities to work together. And so it was really cool to, I mean.
Yeah. Well, auricular acupuncture, the ear acupuncture that you're referring to, part of the reason that works so well for recovery, whether it's addiction recovery or trauma recovery or any of that, directly stimulates the vagus nerve.
I was going to say specifically the one, it wasn't Shenmen, it was the other one that goes in first. Yeah, that was absolutely stimulating it. Yeah, exactly. Yeah, it's been a while because I can't practice in Minnesota, so I haven't done auricular acupuncture since 2019, maybe early 2020. So it's I know there's the Shenmen is the one that looks like the little fish, and then there's the ear and the lung, but anyway, the lung and the heart. I mean, anyway,
and kidney
kidney. That's right.
And it's interesting some of the reasons those work too, because the first one, like you said, sympathetic, is to calm the sympathetic nervous system.
Yeah,
it does the same thing. But then in Chinese medicine, every organ has an emotion.
Oh,
yeah, it's lovely. It's great, right? Because it actually helps kind of figure out some of the underlying pattern of what's going on with the patient. So, when you put it in the lung point, the lung is associated with grief.
Oh my gosh.
Yeah. And kidney, that's another one in that protocol. Kidney is associated with worry and fear. And to me, that makes so much sense because the adrenals sit right on top.
Right. Yeah. The adrenals are right on top.
Yeah. So you're really calming all of those systems in the body that get overstimulated when you're in fight or flight.
That makes so much sense because we would use it with our trauma clients.
Yeah. So NADA was actually developed specifically for narcotics recovery. Addiction, I can't remember the D drug.
Yeah.
Well, I think. But that was what it was for. And then they realized oh my gosh, this does so many other things. So it's one of the protocols they teach us in school. And we use it so much because it's just such an effective, super, super quick way to bring somebody down from the sympathetic state.
Yeah, it's really cool. For those of you who are listening, NADA is the organization that I certified through. So if you're hearing that, but yeah, they did talk a lot about addiction when it was definitely like to treat addiction, but um, I was like, well, why wouldn't I use this with my trauma survivors? Like this, like it's the same thing.
Yeah.
Um, sorry, I look at addiction as a symptom of trauma. Usually, it tends to be someone trying to cope with something that's beyond their other coping capacity. So,
I mean,
yeah.
it's hard once you've started, I think, I don't know about you, but for me, once you've started looking at everything through a trauma lens, it's really hard to see it otherwise.
I agree. And then, with that, sometimes we don't have to go too far into this, but my fellow ADHDers who are listening, who are also providers, but even those of you who are listening and aren't, there's a part of me that sometimes worries, like, okay, am I a hammer and I just see a nail, but not everything is a nail?
Sure.
And then, and then it's like, okay, or is it just that, you know what, we have a lot of collective trauma because, as you were talking about, a lot of ADHD is, not all, she didn't say all, but we can have symptoms of ADHD and it can be trauma related. And what that got me thinking about is I don't have a complex trauma history. I have a handful of trauma events, but I was like, oh, but I have a parent who lost a parent when they were very young, and the other parent was an alcoholic.
Mhm.
And that parent doesn't really acknowledge that as traumatic, of course. So, but there's the epigenetics of it, plus,
Yeah.
the intergenerational dynamics of it too. And I'm like, that contributed to those incidents. But anyway, I think that's an important thing. If you're sitting there going, well, my parents were fine. I literally don't remember it. Although I will say, okay, like I'm going down a bunch of rabbit holes all at the same time. So ADHD people are with me. I hope you're still with me, Dr. Justice.
Yeah.
Yeah, but like thinking about like, okay, yeah, my parents were pretty good. And then I was gonna say I have a lot of people who are like, my childhood was perfect. And they come in and we talk about it. I'm like, actually, that was abusive.
Right.
But right. And I have a pretty solid lens on it. And
Yeah.
there was some stuff, but not super bad. I would actually say growing up in Catholic school was probably the worst of it, which we're not gonna we're not gonna touch that too much more, but I'll just say that. But then I got to thinking and I'm like, gosh, if you're someone who really can't find the trauma and your parents talk to you kindly most of the time, and didn't shame you, I mean, like, holy moly, it could be epigenetics.
Absolutely. And it's so interesting that you bring up the generational trauma because Western medicine is really the only medicine that doesn't recognize it.
Really?
Yeah, Chinese medicine, I think it's that they say we carry 8 generations with us. In our OBGYN class, they were talking about how, you are so connected to your mother and your grandmother because you were in your grandmother's body and like all of the connections.
Right.
Yeah. So, in Chinese medicine, we absolutely look at all of that. If you look at most religious texts, they all talk about generational trauma, right?
Really?
Yeah, especially the Christian Bible, they talk about it a lot.
Huh.
And it mimics across a lot of the religious uh, organizations.
Yeah, yeah.
It really is something that Western medicine, unfortunately, has not really paid much heed to.
Yeah.
And it really, really does affect us greatly, especially those of us that are empathetic, that are highly sensitive. Um, those of us that go into these fields generally are, right?
Yeah.
We want to help people not feel the way that we felt.
Yeah.
So I think it's a really important thing to look at the epigenetics of it all and acknowledge that, yeah, our DNA has changed. I think there was a study, and I quote this all the time. I really need to find the study again because it's been a long time since I read it.
Uh-huh.
But it was actually on Holocaust survivors, and they were studying the DNA changes from the trauma. You know what
Rachel Yehuda. Uh-huh.
I'm the only one that's ever gone, oh, yes, I know that study.
Oh.
Everybody else was like, what? But it was so fascinating, right? Because it shows the actual changes to the DNA that trauma, that specific trauma had on the lineage. And I mean, do we need much more evidence? I don't think so.
That's actually the study I cite all the time when I talk to people about epigenetics and what it looks like.
Yeah.
Because
I think it's important to note that you can change that back.
Yes, you can. Yes.
Yeah. It's not just, oh, well, this is mine now. It's in my DNA, right? Because that's something that we say a lot. It's kind of like, it's in my DNA. But that doesn't mean you have to live with it.
Well, and it's genotype versus phenotype to some degree, right? So like, for those of you who maybe don't remember, was it biology we learned about that, right? Genotype is the actual gene being a certain way, and phenotype is the expression of the gene. Like, so you may remember talking about phenylalanine and PKU. So if you never had, so you might have the gene for the disease PKU, but if you never have phenylalanine, you will never develop PKU, which is the phenotype of the gene.
Right.
The genotype. And so just for those of you who are like, what the heck is Jen even talking about now? That's
basically down physics and biology and all
that. Yeah. But that's basically what you're saying though, is that like you can have the phenotype or the genotype, you can have the genes, you can have it in your DNA, but you can shift what goes on in the expression of things on how you take care of yourself and heal. And
absolutely. For example, my mother, she has MS.
Oh.
And it's terrible and awful. Yep. And part of the reason both of my parents went into medicine is because she got sick after my brother was born.
Oh.
My dad did a lot of research in epigenetics for me and my brother, essentially, to help us prevent getting MS, right? And how could you do that? How could you prevent yourself from getting something if you weren't able to change that expression of your genes?
Right, exactly.
So, what he found is vitamin D deficiency is a huge aspect of it. There's a lot that goes into MS. Of course, nothing is
right.
One note. It's all multifaceted.
Yes.
In my mom's case, she also suffered an extreme amount of torture, really, unfortunately, when she was a child. I look at that and I go, well, yeah, of course.
Right. Right.
I mean, the poor woman, she went through hell.
Right.
And body kept the score.
Right.
It pulled the trigger on the genetics.
Right. Well, and I wonder this is pure speculation, everyone, but I wonder in some ways if that could even be ADHD.
Sure.
I mean, I don't know. I wonder, I wonder about that. Could you be predisposed? What's that?
I wonder about all of it being connected.
Right. Well, because here's the thing. We don't actually know. And that's something that I appreciate you having said is this is what people think right now in 2024.
Right.
People who are trained and educated in this and experienced. And what we know about the brain and our bodies, I mean, you're going to agree with us. I know, and I just met you, but is a teensy tiny fraction of what probably is actually going on. And so
you're right. We know so little. Every year they're discovering something new about the body.
Right.
And partly what I love about medicine and I love science for that is because it's ever evolving, right? What I have a hard time with is absolutes.
Yes.
I don't do well with that. Yeah. That doesn't leave any room for new information.
Yeah. Yeah. I agree.
Important part of medicine because no two people are the same. And we really have to stop treating them like they are.
Yeah, it's absolutely true. And even the University of Minnesota. So I'm in Minnesota, and the University of Minnesota is known for its twin studies. And even in that, I mean, you see how twins aren't always exactly identical twins aren't always exactly the same. Oh. And there's a lot to that to recognize that, what works for one person isn't going to work for another. It's oh, hey, okay.
It's interesting you're in Minnesota. One of my favorite teachers, it lives in Minnesota. And he also is trained in trauma-informed care. I should send you his information. You too would off Dr. Christian Jovanovich.
Oh, okay.
He's great.
Which school is a Jovanovich, but anyway.
But it, gosh, I don't know, Jen. It's just such a big topic, right? ADHD in and of itself, I think especially in women, so much of it is that we just don't feel safe.
Yeah.
I'm not trying to be too controversial with all of that. It's just kind of the facts. Women, if we want to get into the like masculine, feminine, which I know is also controversial right now, and I'm not trying to get curves and all of the
Yeah.
things.
Let's talk about it though, to the degree that you,
right. The feminine, if you think about it, it women are constantly scanning for threat.
Absolutely.
Constantly.
Yeah.
So if you add any extra threat to that, amps us up 100 times. And what that does is it sends our brain into over multitasking, right? You're scanning every single thing. And especially if you're a mom, you've got kids, you've got to make sure this human stays alive. You've got to make sure that human doesn't jump off of the retaining wall in the backyard. Like, I mean, like
too true.
It's too true. It's constant. Even when you're sleeping, you've got the mom ears and you're constantly listening for a child that might be waking up or, your brother in the middle of the night. You don't know. You just don't know what could be happening. So you're not getting enough rest. You're waking up, you're drinking coffee, you're having wine to go to sleep. I'm not judging because trust me, we've all been there. It's not
right.
Like this is what I'm hearing from my patients, right?
That's what I hear from my patients and people in my personal life. Like
we're all just doing the best we can. We're all just logging each other home, right?
Absolutely.
But if we're looking at it as, oh, just take a Xanax or here you just have ADHD.
Yeah.
They're digging into why their brain is telling them they have to be this way.
Right. Yeah.
If we control it, we would. Right?
Absolutely. Well, and I love what you're saying about that. Like one of the things I work on a lot with the women in my programs and even in my private practice when my clients have, ADHD is just accepting like this is how your brain is wired to deal with what's going on in your life. Like this is just what happened. It's not that you're bad or wrong or defective. This is just what goes on. Because so often, many of us, especially if we were undiagnosed, although, who knows, maybe some of us were undiagnosed because who knows, maybe we didn't have it, or maybe we did. And, it's hard to say. But a lot of us that were undiagnosed, or even if we were, we just experienced so much criticism and shaming and pay attention. You can pay attention here. Why can't you pay attention on this? And so there's even the trauma of that impacts all of that. And so then you add that piece to all the things that you're having to keep an eye on because a lot of us learned to mask so we wouldn't get in trouble.
Yep.
And so like, I know I did. I went to Catholic school and it was like, I saw what they did to the kids who got in trouble and I was like, I'm not doing that. And so I figured it out. But it's taken me years to unload or unwind from some of that. And then now that I don't mask as much anymore, it's like, whoa, Nelly, And so I think that happens to that can be a common experience, I should say, not happens to, but it's a common experience of ADHD women. And it's like, when you put the trauma lens on it, though, just even being female.
Yeah. It's a trauma in and of itself, isn't it?
No, for real, though.
It is. And I laugh, and please don't misunderstand. It's the morbid gravesite humor.
Oh, no,
but
yeah, I'm a therapist. We have morbid senses of humor.
I know. So well, you and me, like the therapy. Yeah. My sister-in-law is actually a social worker, and we do that. We'll have our downloads every so often where I'm like, bro.
Right? Right. Seriously, though. No, seriously. And that's a really good point. Is the women are going through a lot of that. And it's something I've actually been curious about. You talk about ADHD, and again, we're not telling anyone they don't have ADHD.
No,
but because you still meet criteria, even if the underlying reason for it is not, I don't know. I don't even think we know, actually. I think that these things exist. Yeah.
I just disagree that you have to live with them.
Oh, yeah. And that's kind of what yeah.
Yeah. So absolutely, when a patient comes in and tells me these things, of course I believe you. Of course
Yeah.
I think things are happening. Do I love calling it ADHD? No. Because do I think that helps anybody? No.
Yeah.
Does a diagnosis or a label help? Sometimes. Now let
Yeah.
me let me back up. Sometimes it's helpful to
Yeah.
hear, yes, you have this,
Uh-huh.
but I don't want that to get stuck in your identity,
Yeah.
right?
Exactly.
And you can't release it from your tissues if you,
Right.
you take it on as your identity.
Right. Well, I wonder if you'd unpack this a little bit, because one of the things I talk a lot about, I love the Huberman Lab podcast. I don't know if you're familiar with Andrew Huberman. He's a neuroscientist, and he actually talked about like the neuroscience of ADHD, and he talked about he had another episode on dopamine for motivation and stuff like that, and like not taking like how to naturally
How to boost it.
how to
Yeah.
boost it, right? So anyway, he talks a lot, like our brains are just wired with ADHD. They do different, the way they get us to do stuff, like our ability to store dopamine is different. Like we don't have as much access to dopamine as other people do. I'd have to look at my notes to make sure I'm quoting this correctly, but like it was something to do with how our like just having access to it. And then he actually talked about something interesting about Parkinson's, and that their dopamine receptors actually, I think, are going away or something like that. But there's like this thing about dopamine receptors not being as accessible for the ADHD brain. And because dopamine isn't just about pleasure, y'all, it's also about interest, motivation, and executive functioning, that can be a piece of it. And so I'm curious, how does that translate into what you're talking about in terms of um, like, does the trauma create that, or is that already there? Is that genotype phenotype again?
I mean, in terms of like the atrophying of the receptors,
Yeah.
yeah, I would say that it would stand to reason that trauma could do that for
Yeah.
sure.
Yeah.
Especially long trauma or complex, right?
Yeah.
Because what's that going to do? You start losing interest.
Yeah. Yeah.
If you're fawning for
Yeah.
years.
True.
You're just, that's not going to be as needed. But in my experience, I mean, the body is regenerative, and we have proved that, right? You can live donate your liver and it will grow back.
I know.
So
Is that crazy?
I know. I'm like, so don't tell me you can't heal from this stuff. I don't believe you. Maybe we don't have the science yet.
Yeah.
Maybe we don't have the understanding.
Yeah.
But that doesn't mean it's not possible.
Yeah.
So I think that, I've had a lot of success with patients who were able to kind of, I want to be careful with how I word it, but retrain their brain, perhaps, is a good way to say it.
Yeah.
Regenerate. They say that you can't regenerate the brain. I disagree.
Yeah. Well, they also said the brain was stopped developing at 25, and now we know about neuroplasticity. So it's like, okay.
We know about the brain damage that trauma causes.
Exactly.
Like all of the things that happen to that gray matter in between your ears can be reversed. And so, like I said, I'm different. I'm of the opinion that everything can be reversed. Do I think I can help you with all of it? No, absolutely not.
Right.
But don't tell me you can't. Let's just,
right.
My whole thing, and my staff knows that's about me too, is don't come to me with problems, come to me with solutions.
Yeah.
Or very least come to me and say, I don't know how to do this yet.
Yeah.
That's
with an open mind. Yeah.
Just have an open mind. Or, if there is a brick wall that we hit, fine. How do we get around the brick wall? There's always a solution. We just find it, essentially. And sometimes that means the solution is me referring you to a different practitioner.
Yeah.
Because I've hit my limit of what I can do with you.
Yeah.
And I think that's also something that is lost in medicine. Not a lot of doctors are willing to admit that they've hit their limit.
Yeah. I think that's really awesome that you're talking about that, because a lot of, not all, but some of my audience are providers also. And so it's, it's a good thing. We talk a lot about that in social work, knowing when you're beyond your scope, not just scope of like practice and what you're allowed to do, but also what you feel competent and able in the moment to do. Yeah.
about you guys.
What's that?
I love that about therapists too. I mean,
Yeah.
I think you guys just have such a great understanding of boundaries, right? Like
Yeah.
that's not something we get taught in Western at all.
No, that's clear. That's clear. My clients come into me and they're like, so my doctor told me if I prayed to Jesus, I wouldn't have anxiety. Or like yeah, like,
That's mortifying.
yeah. But I mean, like,
Sure.
right. But I mean, it's just, I mean, they get told other stuff that's maybe less dramatic than that. But like,
That's important to note that that's a trauma too.
it is. Oh, no, I know. Because we have to work on it then.
Oh, of course. Yeah. I
And now they're scared.
sorry, I meant for like the audience. Like,
Yeah. Oh, yeah. No, of course. But duh, of course. Yes. But
yeah.
you're all still there. I remember you. Yeah. Yeah.
Medical trauma is a huge, huge thing.
It totally is.
There's a big reason why white coat syndrome is an actual thing.
Yeah. Totally. That makes sense. Yeah. So we've got a little bit of time left. I want to talk a little bit about the hormonal aspect of all of this. Hormones around ADHD specifically, or like, how do those interplay, or is it all through the trauma?
I wouldn't say it's all through the trauma just because
not all or nothing. Yeah.
I'm not an all or nothing kind of, well, that's not true. I can be, but in this case, in medicine, I'm not all or nothing because you kind of have to be willing to change and flex and,
Right.
so yeah, with that goes back to the hypothalamic pituitary adrenal or the HPG, the gonadal, depending on what we're talking about. For example, women with PCOS.
Uh-huh.
I have noticed a trend, and of course not 100%, but there is a large percentage of my patients that I see in my practice with PCOS with sexual trauma.
Me too.
Yep. So, and actually one of my OB-GYN teachers in med school also said this, that she noticed that trend as well. It's interesting to note to me that the body protects itself in whatever way it needs to, right? So if you look at where the dysfunction, or I don't even like that word, like maybe dysregulation is better, because it's not dysfunction, it's working. It's just doing what it thinks it needs to do.
Yeah.
So you have something like a sexual trauma, the brain goes, well, we don't want anything else coming in here.
Yeah.
Right. So it just hyperstimulates testosterone, hyperstimulates these steroid hormones and these androgen hormones that are going to now, quote unquote, protect the body. It's kind of the same thing with any stimulation. It just depends on how the body decides to fix it. So if we're talking about neurotransmitters, for example, again, it's kind of like, okay, something stresses you out. You're already hyperstimulated. So then you get, more of those excitatory neurotransmitters.
Okay.
And what do you do with all that energy?
Right. Right.
Again, you can take stuff. You can take the, there's herbs you can do. I like herbs for some things. I also like the nutrient itself.
Yeah.
GABA, for example, is really, really great to just help kind of bring that down.
Yep.
Everybody's a case by case, right? I kind of have to talk to them and see where their overstimulation is, and kind of interrupt that feedback loop.
Right.
But sorry, I'm not sure if I answered your question.
You did. You talked about, you totally did. You totally did. Because what I was wondering is like, what hormones are you talking about? And you spoke to that, and I was trying to understand the interplay of it.
I mean, there's hundreds of hormones in the body.
Yeah. Yeah.
It's hard to just pick out a few because vitamin D is a hormone, for example.
Oh, really?
Vitamin D is actually a hormone.
Oh, no, I had no idea.
Most people don't. So, when we're saying like hormones, I want to be clear that I'm really only talking about a couple of them here. There are so many that regulate the body, including like melatonin, estrogen, progesterone, DHA. You've got like everything plays together. And especially in a cis female body
Yes.
cycle, every week we have different hormonal cycles.
Right.
So when we're talking about hormones, we really have to understand that it depends from week to week, from day to day, from experience to experience. That's how the body keeps you in homeostasis. So
Right.
it really, like, I don't know, it could be that your estrogen is too low and your testosterone is too high, and that's why you've got these ovarian cysts going on right now. It could be that, you've got too much dopamine going on, right? Like
Uh-huh.
that's your issue is there's just too much dopamine and we've got to kind of balance that back out.
Right.
But you have to be really careful because we're messing with the brain. We're messing with the entire system and how it, um, and it's that those two bears fighting over food. You don't want to just come in with guns blazing.
Well, that's what I was actually going to say. Like, it seems to me if we're going to be messing with our brain chemistry doing things, safety is of the utmost importance. And and when I talk about like ways of regulating the nervous system, right? Because I use polyvagal theory, and I'm like, hey, here's how you can regulate into the ventral vagal state, but only when you feel safe enough to do so,
Yeah.
because it's not safe to do like, I mean, like I teach the calmness mudra is one thing. You lift your hands up and you shake them like jazz hands. And then I'll have them do like, because that'll shake off the adrenaline, and have them do like 5, 4, 3, 2, 1 after that, or something called volcano breathing that comes from Yoga Calm, where you have your hands together in front of your heart. You inhale, bring them up. Exhale, bring them down and around back to center. It's slower than that.
Yeah.
But that's not safe to do if you're in an unsafe environment. And so then, what I hear you saying is that it's really important if we're going to be, and this is why you shifted to being trauma informed, is that if we're going to help people with whatever other issues they're coming to, that we also need to first create safety in their lives and in their bodies and just all around, which is really hard in this day and age. And, I don't want to go down that rabbit hole right now, but there is a lot of traumatic things going on in our world.
On fire. The world is literally on fire. Yeah.
The world is literally on fire in so many different ways. And so it's like the challenge is how do we get people feeling safe enough to be able to do that?
Well, and let's be honest, I don't think the majority of us have been taught how to regulate our nervous systems or our emotions. So, I mean,
No.
everybody's just learning, right? We're all just trying to figure it out, especially those of us with complex trauma backgrounds, right?
Right.
That really informs how we show up in the world.
Right.
Unless we can figure out how to change that pattern,
Right.
we're just going to keep fighting the same battles, unfortunately.
Yeah.
I mean, I don't want to not include men too, because men, unfortunately, are just trained not to have emotions, and that's just terrible. Just terrible.
Yes. Yes.
Like, so many of the chronic illnesses that we have in the world, but in this country specifically, are just from dysregulated nervous systems.
Wow.
And I think it's not
a just. Yeah.
But in my mind, it is it's an underlying current through everybody. And it's so many of my patients, I don't do oncology and I don't really see cancer patients anymore, but in the past I have. And so many women that came to me for support with breast cancer, I noticed an underlying trend of neglect.
Oh.
So much emotional neglect. They are pouring from an empty cup. They're caring for everybody else. They're making sure everybody else stays alive and they're not receiving.
Wow.
Am I saying that that's the cause? No.
No.
I'm saying like there is this interesting trend. And if we don't at least take a look at the emotion underlying all of these diseases, I think we're really doing a disservice to people in general. And we're really missing out on a large, huge swath of healthcare. So, that, like I said before, I think that's one of the things I appreciate about Chinese medicine so much is that we really do look at the body as a whole. Mind, body, spirit must be in balance. That's the entire theory of yin yang. It has to be in balance.
Yeah. We lost that when we separated the brain from the body in Western medicine. We lost a lot. I think there's practitioners bringing that back together, but it's a slow process. It's a slow process. I will say, like there's bigger people too doing this work, like a Bormate, and he's fantastic. He's up for those of you. He wrote a book called When the Body Says No, and he is a physician who was listening to his patients, which is amazing. Most of whom were women, and they all had these strange autoimmune diseases. And sure enough, they all had like complex trauma. And I mean, and so essentially, I mean, I shouldn't say all, but noticing a connection.
Yeah. And Dr. Amen. The brain and all of the stuff there that gets affected. And
it's so connected. Well, and when we think of ADHD too, one of the things I talk a lot about when people are like, I can't focus or I can't motivate myself to do something, I'm like, regulate your nervous system and then tell me if you can. Because so often, like, I'll even do that for myself. The other day I was like going in circles. I had so much on my plate. I didn't know where to start. And I was like, I'm going to go for a walk.
Yeah. That's actually one of my favorite tricks.
Uh-huh.
When a patient tells me like I don't know, I'm going to freak out or, I'm having heart palpitation, whatever. Do me a favor, go for a 10-minute quick walk. Don't go crazy. Just real quick, walk around the block, because it tricks your brain into thinking you've left the danger.
Yep. Yeah, it works so well. I used to go for a walk between every single psychotherapy session, and I used to go outside, and then I got out of the habit when the winter was cold, so I need to get in the habit. Now I just climb the stairs in my building, but it made such a difference to not take on what people were sharing, right? Like, yeah, that walk is so important. So, oh my gosh, I could talk to you for like 10 hours. Like for reals.
We'll have to do it outside of this.
I know, right? Right. It's totally true. So, right. So what I guess what I'd love for you to share is if you wanted to, like, what can you recommend? So a lot of my listeners are women with ADHD. That's who we work with. And I mean, a lot of them are going through perimenopause, and we didn't have time to even touch on that, which
it compounds the ADHD. I'm so sorry if you're struggling.
Don't apologize. I have ADHD. I take us off the rails all the time. It's just part of it.
That's why I was able to follow your rabbit trail.
Oh, yeah. That's why you can follow the rabbit hole. It just happens. And everyone who listens has ADHD, so everyone else can follow. So it's like whatever. And if they can't.
My podcast is kind of like this too. So it's not.
Yeah. It's just like how it goes. Yeah. And so I guess like if people are like, even people who are perimenopausal let's see, we've got a couple minutes. Do you want to share real quick? Is there a quick way to share what that means in like a elevator speech of like perimenopause versus menopause?
Perimenopause is the time leading up to menopause. So for some women, that could be a day. For some women, that could be 10 years. Who knows, right? But it's basically the decline in the fertility hormones that lead to menopause. So you can start getting some of those traditional menopausal symptoms, right? The hot flashes, the night sweats, the low libido, memory issues. So many different things. Insomnia, brain apathy. There's pretty much all the things, right? And then menopause is actually the absence of your period for more than a year. So a year or longer. Right. So there are times in your life, not necessarily, how do I want to say this? Like the word is like, oh, I'm menopausal, right? Well, no, technically
Yeah.
Like technically that's when you stop bleeding and you're menopausal after a year of that.
Yeah. Yeah.
You're premenopausal when you're in your fertility phase, which
Right.
sounds weird, but
Yes.
medical terms are weird.
Medical terms are definitely weird, particularly around women's bodies.
Oh my gosh, don't get me started on.
I know we'll go down a rabbit hole if we do that, but okay. So I hear you talking about brain fog. I hear you talk about memory stuff, and then sleep problems. Okay, so like if I don't get sleep with ADHD, I don't function.
Yeah, same.
So like my sentences aren't as coherent today, in fact, in this episode, which is just how it is, because I haven't been sleeping well the last week.
Funny you say that. I was actually thinking the same thing. I was like, gosh, I've been stuttering a lot.
I know, right? Like we're both kind of stuttering. It's okay. It's okay. It happens, right? But it's just part of the thing with ADHD. It just happens sometimes. And I'm thinking, okay, so if you're not sleeping well with perimenopause, well, that's not going to help your ADHD. And if you have additional brain fog or memory issues, oh, good grief. Like, so what's a girl to do, Dr. Justice?
Well, the first thing I would do if you came to see me in my practice is test your hormones and just baseline and see where we were at. Yeah. I am different in that I ask a lot of questions of my patients. I spend an hour with a patient on their first visit with me.
Yeah.
Really dig into kind of what's going on. I can't just throw out take a melatonin because again, that's a hormone and I could make you worse.
Right. So, well, there can be other issues with melatonin for sure. Yeah.
For sure. And again, we're going back to the gene expression, right? If I am not doing my due diligence and finding out what's going on in your body and I give you something that could change that genetic expression, I can make you worse in a lot of different ways. So I'm all about just let me get a baseline. I don't do a ton of testing.
Yeah.
But I do hormone testing for sure.
That's smart.
And neurotransmitters if we need to. If somebody comes to me with really severe ADHD, I'll test our neurotransmitters.
I didn't even know you could do that. I remember like 20, I was already in the field a couple years, but I was still in grad school. So maybe it was like 20 years ago or so. They were saying like, this is coming someday and it's here.
Yeah, I love it. It's great. Because I can tell so much about what's going on in the brain, right? And usually it's, again, I probably shouldn't say this, but often, not usually, but often I can correct it with some simple nutrients because really that's how the neurotransmitters get produced anyway, is just from what you're eating. And unfortunately, our standard American diet is terrible for sort of health at all. So sometimes it's just adjusting those types of things and replenishing the body. And my goal is to get you to a place where you don't need me.
Yeah.
I love to teach because I think education is power and you should be able to advocate for yourself if I'm not around for you, right? You shouldn't be afraid to go to a doctor. And a lot of us are because we don't get heard. So a lot of what I do is educating my patients on that too, so that they can do that for themselves. So I teach them through their neurotransmitter test with them, and I show you like where everything is imbalanced. And medicine is an art, right? Everybody is different, and I'm not always going to get it right on the first try. I'm pretty good. I'm not gonna lie.
Right, but everyone is so unique, like you said, right?
Can't always predict how somebody is going to react to something.
Yeah.
Risk is way lower. I'm not giving you pharmaceuticals.
Right.
But it's still risky. It's still internal medicine.
Risky. Yeah. So, as we're wrapping up here, if people want to find you, you gave me your email address and I'll put that in the show notes, but also your Instagram is at Dr. Justice DACM. Is that correct? Yeah.
So it's DR, Justice.
DR. Yes. Thank you.
Or spell it out. And it's D is in doctor, A is in acupuncture, C is in Chinese, and M is in medicine. So.
Cool.
Yeah. So it's just your
credentials.
Yeah. apparently Dr. Justice is a common handle. So,
Oh, right. Because just, okay.
yeah. So it has something in there to make it a little stand out a little bit. But
That's excellent.
and my website is the same,
Yeah.
drjusticeacm.com. I also have a podcast, The Collective Health.
Oh, cool.
But to be really honest with you, I had to take a hiatus for a little bit. We haven't recorded anything in a few months, but we're hoping to come back. And Jen, I'd love to have you on too.
Oh, that'd be great. Let's do it. Yeah, let's do it. Let's do it. It'd be awesome. Yeah. So those are ways to find justice. And my understanding is you have lots of options for people to, like, if you want to do like a mini program or like work with more deeply or do a program, that all that information is on her website. So yeah.
Ranging from $47 to big programs that you work with me for months.
So cool. So cool. All right. Thank you so much for being on the show. This was so great to have this conversation and talk about women's health and ADHD and hormones and trauma. You know, I love to talk about trauma, everyone. So it's trauma.
Yeah, thank you. It's been an honor. I appreciate it.
Great. Thank you so much. All right, y'all. If you're not following yet, be sure to follow and share. I'll see you next time. Take care.